attacks on healthcare, which have resulted in 101 deaths of health workers and patients. The war is exacerbating health needs, including for mental health and psychosocial support, rehabilitation, treatment for diseases like chronic diseases, and others such as cancer, HIV, and tuberculosis, and vaccinations for measles, polio, and pneumonia, and COVID. These gaps are a risk to health today and for the future. WHO is working closely with partners in Ukraine and has reached 8.4 million people with health interventions. WHO has delivered nearly 300 metric tons of life-saving medical supplies, including ambulances, generators, medicines for chronic diseases, and trauma and surgery emergency supplies to Ukraine since the start of the conflict. To support our work, WHO has appealed for $240 million to reach 11.4 million people with health assistance in Ukraine and refugees receiving countries. The conflict is affecting health not just in Ukraine, but around the world, with millions of people impacted by spiking food prices, especially in low-income countries. As always, we need health for peace and peace for health. Finally, on COVID-19, new research adds to the weight of evidence about the benefits of vaccination and boosting, as well as dramatically reducing the chances of severe disease and death. The research reinforces that vaccination and boosting also reduce the likelihood of patients with COVID-19 from having a heart attack or stroke. I emphasize these findings because it underlines once again why governments should continue to vaccinate and boost their populations, especially the most at-risk groups, including older people and health workers. It's also critical that governments maintain and strengthen surveillance and sequencing so that as the virus evolves, vaccines, therapeutics, and diagnostics can be evaluated and updated quickly as needed. This week, WHO's Technical Advisory Group for COVID-19 vaccine composition emphasized the need for continued surveillance to guide the composition of vaccines and to assess their effectiveness. While the world is collectively in a better position than it was 3 years ago, this virus should not be underestimated. It's therefore important to invest in research in order to develop vaccines that can provide broader protection and also reduce transmission. Earthquakes, conflict, and the ongoing impact of the COVID-19 pandemic all reinforce the fragility the world faces and the need to strengthen our collective defenses against health emergencies. This week, WHO member states are hosting discussions on amendments to the international health regulations. Next week, countries will begin negotiations on a zero draft of the new pandemic accord. These discussions will be crucial for building a more effective health security architecture for the future, grounded in international law, equity, and the fundamental right to health for all people. At the Munich Security Conference last Friday, I said that right now, the world remains unprepared for another pandemic. While leaders have many other crises to deal with, attention on future epidemic and pandemic threats must remain, or we will pay a heavy price. No crisis happens in isolation. In a world of converging and overlapping crises, we need a shared, coherent, and equitable global approach to shared global health threats. Christian, back to you.
Thank you very much, Dr. Tedros. With this, we open the floor to questions from the media. And let me remind you again, to get into the queue to ask questions, please press the raise your hand icon on your screen and then unmute yourself when it's time to go. First question goes to Musa Asi from Al Mayadeen TV. Musa, please unmute yourself.
Vous m'entendez?
Yes, very well.
شكرا كريستيان. سؤالي بالعربية. في 9 من شباط فبراير
Musa, give us 1 second. We need to put on the
يعني
Musa.
رفعت الولايات المتحدة جزء من العقوبات عن سوريا لكي يتسنى دخول المساعدات الإنسانية. اليوم بعد مرور أسبوعين على هذا الأمر، هل لاحظت منظمة الصحة العالمية تغيير بدخول المساعدات إلى سوريا؟ وهنا لا أتحدث فقط عن المعدات الطارئة كالأدوية والأمصال وغير ذلك، إنما عن المعدات والآلات الطبية التي يحتاجها النظام الصحي في سوريا وإعادة بناء المستشفيات وغير ذلك. شكرا جزيلا.
So thank you very much, Musa. We didn't immediately catch the beginning because we didn't have time enough for the interpretation, but
Rick Brennan.
yes, exactly. But we go to Rick Brennan, who's the Regional Emergency Director in the Eastern Mediterranean region, and he's joining us from Gaziantep.
Thanks, Christian, and thank you for the question. A great question. WHO is moving very rapidly right now, together with our partners, to take advantage of this pause in the sanctions. We have already started ordering equipment and supplies, and we are working with UN partners on a collective approach to take advantage of the pause. You're absolutely right. We not only need medicines and consumables and vaccines, we need vital equipment like X-ray machines, surgical equipment, and so on. So at the same time, we are doing a more detailed assessment of those needs, and we'll be moving very, very rapidly to do the procurement, capitalizing on this important opportunity that we have. So, you know, I'm confident that things are moving in the right directions. We've already had 4 airlifts, planes full of supplies and equipment come into Syria since the earthquake, and we will be moving into a situation where we'll be able to bring in that heavy equipment in the weeks and months ahead. Thank you.
Thank you very much, Rick. And I understand Dr. Kathy Smallwood, who's the earthquake incident manager for Europe, can join.
Thanks very much. Just to add, of course, that under COVID, we found it very difficult to get laboratory supplies into Syria in both directions, and we'll be working really to use this opportunity, as the Regional Emergency Director said. Thank you.
Thank you very much, both. With this, we go to the next question, and that goes to Erin Parata from Fortune. Erin, please go ahead and unmute.
My question was addressed. Thank you so much.
Thank you very much. Lucky today. Next question goes to Simon Ateba from Today's News Africa. Simon, please go ahead.
Yes, thank you for taking my question, Christian. This is Simon Ateba with Today News Africa in Florida. I wanted to have an update on the Marburg disease in Equatorial Guinea, Cameroon, and the neighboring countries. Thank you.
Thank you very much, Simon in Florida, and we'll go to Dr. Abdi Mahmoud for this, please.
Thanks, Simon, and just would like to take this opportunity to thank the Minister of Health of the 3 countries for the rapid deployment of teams, and then for strengthening the basic investigation and healthcare. As we speak right now, we have currently 9 deaths, including the 1 confirmed, and particularly there's a detailed investigation with teams from WHO headquarters, the regional office, and with the Minister of Health there. So we don't have more update because there are several cases happen, suspected, confirmed cases, probable cases. So we'll be waiting to get that detailed outbreak response from the field team, because a lot of the death happened before this was declared. So it will be a lot of retrospective investigation and a detailed investigation on that. What's more important right now is the the readiness in the neighboring countries. Cameroon and Gabon both moved in a rapid action, and they have strengthened their readiness, and particularly in the surveillance, and more importantly, in the community surveillance. At WHO, we're working very closely. Just yesterday, the executive director and the DG have released $500,000 to start the initial plan, and then to enhance further the response. But coming back, outbreak start and end in the community, that the community engagement and bringing this community on our side will be very, very much appropriate and the initial step. As we have learned, and as we, from the lessons in Uganda, integrating research is very key into this, as we don't have right now proven and approved countermeasures. And we've been communicating with the Ministry of Health to accelerate the research into this response.
Thank you very much, and Dr. Mahmoud. And next question goes to Belisa Godinho from W Magazine in Portugal. Belisa, if you hear us.
Hello, everybody.
Yes, all good.
I'm Belisa Godinho from W Magazine based in Lisbon, Portugal. My question is related to global health prevention. The recent problem of the lack of dialogue in successful negotiations for peace between Ukraine and Russia, and the breaking of the New START treaty with the United States makes it urgent to have correct information about the effects of atomic energy weapons on human health, for the health of all living beings and the health of the planet. Can WHO help clarify this matter? Thanks.
Thank you very much. We'll start with Dr. Michael.
No, I think everyone is aware of the devastating effect of nuclear weapons and radiation can have on people who are not properly protected. So WHO remains very concerned about radiologic safety in all settings, and especially in Ukraine, given the war. We support our colleagues in the IAEA, who are the responsible agency for this. We're a part of a medical emergency response network with IAEA. We continue to work with the Ukrainian authorities to ensure that we've got adequate training of health workers on the Ukrainian side. But obviously, from what you mentioned, the issues here are not about health. The impact will be on health, but this is not in itself a health issue. This is obviously a very, very political issue in the middle of a very devastating war. So we would call on all sides in the conflict to ensure that sites where radiologic material is present be protected and be avoided in any form or shape in this conflict. And that just echoes the calls of our colleagues in the IAEA over many months. But we do have a team working on this. We are ready to support and work with other agencies should anything happen. And we've been working with Ukrainian authorities on that diligently over the last number of months. But this is a real issue, and everyone needs to be exceptionally careful. And quite frankly, I'm not as concerned about the intentional use of anything. I'm more concerned about accidents, and I'm more concerned about the fact that nuclear plants continue to be run in a manner that requires a lot of courage and a lot of commitment from a very small number of staff. And we just want to make sure that everyone remains safe. And we do commend those workers who continue to work to keep those plants safe, particularly in Ukraine.
Thank you very much, Dr. Ryan. Next question goes to Miriam Nadaf from Nature Magazine. Miriam, please go ahead and unmute.
Hello. Hi. I hope you can hear me. I would like to ask if WHO have already or plan to supply the semi-besieged northwest region of Syria with basic medical supplies such as antibiotics. We are concerned of spread of infections post the earthquake. As we all know, 3 crossing points are now open on the Syrian-Turkish border, but before the earthquake, there were only 66 hospitals serving 4.5 million people in the northwest of Syria. And doctors on the ground have told us that most hospitals have run out of antibiotics on day 3 after the earthquake, and even with simple injuries, most patients would need antibiotics or some sort of painkiller. So I'd just like to know if there are any plans, if this has happened already, or if there are any new plans to do that as soon as possible to respond to the urgent needs of the hospitals and medical facilities there, specifically supplies of basic medicine like antibiotics and painkillers. Thank you.
Thank you very much, Miriam. I understand we have a bit of an audio problem to our regional colleagues, because this would be perfect for Dr. Rick Brennan, the Regional Emergency Director in the Eastern Mediterranean region. We're just trying to submit the basic ideas of your questions to him and hoping that they can understand us and hear us, and then can answer that question. Otherwise, that's a good idea. Actually, we start here in the room with Dr. Adelheid Marschang. She's the Health Operations Lead for the earthquake response. And if we get the line back, then we'll go back to Dr. Rick Brennan. Thank you. Dr. Adelheid Marschang, please.
Yes, thank you very much for the question. As you know, we have been operational in doing cross-border services and humanitarian assistance for the last 10 to 12 years. So we had an established pipeline of supplies, medicines, and technical services into northwest Syria prior to the earthquake, which has now been scaled up. And thank you for referring to essential medicines. Clearly, we have scaled up the supply to those, including antibiotics, painkillers that you have highlighted, but also trauma supplies. And we're looking now into increasing also the proportion of NCD, meaning non-communicable disease medicines, that are growing more and more important in the needs as far as we receive from the communities and from the health facilities that the partners are supplying, with who we are constantly working. And as DG has mentioned, 3,000 tons of supplies have already been delivered on the ground throughout the operation, including, of course, and with a key focus on northwest Syria. Back over to you.
Thank you very much, Dr. Marschang. And we have also...
Is he online?
Go ahead. Yeah, Dr. Smallwood would like to add.
Let Katie add. I'll join in the end.
Yeah, so we'll start with Dr. Catherine Smallwood from the Earthquake Incident Manager for the European region. Go ahead.
Yeah, I just want to say that I've been in Syria twice over the past week, and my colleague Rick Brennan and Gerald Brockenschaub online were in Syria yesterday, and they can speak for their views. What was clear to us is that in the immediate days after the earthquake, all of the distribution systems were actually disrupted, because our partners on the ground and the healthcare workers on the ground were immediately involved themselves in the search and rescue operations. Since then, of course, as my colleague Adelheid has said, we've been able to really reestablish our distribution channels within the country. And we've moved over 139 new tons of medical supplies, including antibiotics, as you mentioned, and other surgical supplies to affected areas. Perhaps Dr. Brennan and Dr. Brockenschaub can also give their views on what they saw yesterday.
Dr. Rand.
Yeah, just to add to that, I think we've been working with 141 NGOs within the health cluster. We really like to pay tribute to those non-governmental organizations who operate all across northwestern Syria, who we've been providing more than 50% of the medical supplies into northwest Syria, for, as Adelheid said, for over a decade. We're very pleased to welcome the media attention back to this forgotten crisis. Our staff, our NGOs, and our focus has been entirely on protecting the lives of over 2.7 million people caught in the most desperate struggle for life long before this earthquake happened. And I would just like to recognize that in the aftermath of any major crisis, there are always frustrations. There's never the supplies. The supply chains are disrupted. There may be breaks in supply chain. Our job is to fix that. Our job is to re-engage with the NGOs, fix those supply chains. That's why our staff have been over there. That's why we continue to work. But I think it's a false premise to present a view that nothing was happening in advance. The earthquake happened, there were no supplies. We have been there for a decade. We will be there through this earthquake, and we will be there until the suffering of these people is ended. Not just the suffering caused by the earthquake, but the suffering caused by this insufferable war.
Thank you very much, Dr. Ryan and all. I have right now one more question in the queue, so that's your chance actually to put your hand up, because I saw 2 hands went down. It looks like many had the same question today and that they were all answered, which is great in some way. So for now, the last question goes to Mega K, if I get that right, from Health Policy Watch in Geneva. Mega, please go ahead.
Thank you, Christian. Am I audible?
Yes, please.
Okay, thanks. So there was a recent piece on a publication based on a comprehensive analysis of studies that said that masks were not effective in addressing the pandemic and other respiratory illnesses. I just wanted to know what the WHO's position on that is right now. Thank you so much.
Thank you very much, Mega. To change of topic, and I understand we have Dr. Maria van Kerkhoff online. So Maria, if you could take that.
Yes, thanks, Chris. So thanks for the question. So we continue to advise the use of masks as part of a comprehensive strategy to reduce transmission of COVID-19. The virus is circulating pretty much unchecked around the world at the moment, and masks, the appropriate use of masks over your nose and mouth, are one of the ways in which we can reduce the spread and we can prevent infection, we can prevent transmission. There was a systematic review that was published that was looking at randomized controlled trials, but as an organization, we continue to look at all available evidence that is provided to us, that is published through this pandemic into the 4th year of this pandemic, as well as looking at other studies of other respiratory diseases, including flu, but also looking at influenza-like illness, acute respiratory infections, severe acute respiratory infections. And again, I reiterate that the use of masks continue to be part of our strategy to reduce the spread. One of the ways. We have a strategy that is out there that is based on vaccinations. It's based on distancing as much as possible, as much as reasonable as we go about and live our lives, wearing a well-fitting mask when we're around others, and particularly on public transportation, and certainly among health workers. The use of masks and respirators, as well as other personal protective equipment, remain absolutely essential to protect our frontline workers who are providing optimal care to patients around the world. So we will continue to update our recommendations for health workers as well as for people in the communities to do what they can to live their lives as COVID continues to circulate. But again, masks remains one of the recommendations that we have because we know that they are effective at preventing some of the transmission. They're not perfect. That's why we have a comprehensive strategy, a layered approach of many different types of interventions. So thanks for that question.
Thank you very much, Maria. I see one last hand, which we're going to take now, and that's Jamie Keaton from the Associated Press. Jamie, please go ahead.
Thank you, Christian. Just going back to the Northwest Syria situation, and after Mike's strong reminder that WHO has been getting aid into Syria for some time. I guess this is for Dr. Brennan, if you can hear me, is what concerns do you have about people in need in northwestern Syria that may not be getting the aid? In other words, what difficulties are you aware of about the distribution once the aid gets across the border and actually once it's inside northwest Syria, whether it's actually being distributed? Because we've had concerns from the white helmets, as you may know, about them not being involved or receiving any UN-related aid. Thank you so much.
Yeah, thanks, Jamie, for coming back to this, but I'll give back over to Gaziantep and to our colleagues there. Maybe start with Dr. Rick Brennan, if you're still online, the Emergency Director for the Eastern Mediterranean. Rick.
Yeah, thanks, Christian. And again, thanks for the question. Perhaps building on what Mike had said earlier, Gerald and I went into Northwest Syria yesterday. We covered quite a bit of territory, visited some of the worst impacted villages and towns from the earthquake. And what was clearly visible to us, in addition to the immediate impact of this crisis, was we were visiting communities and health facilities that had suffered the deterioration of 10 to 12 years of conflict, recurrent displacement, and major economic decline. Already around 90% of the population was living below the poverty line. And this, the earthquake has just been another amazingly difficult compounding insult. Mike talked about the many needs. These people have also gone through the COVID pandemic, an ongoing cholera outbreak, and on and on and on. So the health system has deteriorated remarkably in that context. Certainly health facilities are under-resourced. So what are the priority needs at the moment? I think we're in the early recovery phase. There are still persistent trauma needs, but most of the acute trauma needs have been addressed. There are needs for just basic essential health services at primary care level, but also at hospital level. My colleague Adelheid Marchang talked about not only the basic health kits at primary care level, we've got to bring in the treatments for the chronic diseases like diabetes and insulin and so on. And people have been displaced and they've lost access to their regular health services, in part because of that, in part because of damaged health facilities. So we're working to address that issue. There's a big issue related to infectious diseases. I've mentioned the ongoing cholera outbreak, but now we've got new levels of displacement and people overcrowded in these collective centers that are unhygienic. There's poor sanitation, poor water. So we're working very closely with our partners on ensuring that there is better water and sanitation and infectious disease control across the board, but with a big focus there. And in fact, we have 1.7 million doses of oral cholera vaccine on hand right now. And that we will be targeting those most vulnerable communities at the end of the first week of March. So that's a big priority for us. Mental health is another major priority. So they're the big issues that we're looking at right now. We will, as fast as possible, and as soon as those resources arrive, the desperately needed resources arrive, we will shift gears into basic rehabilitation of health facilities as well. In the meantime, we're working with partners to run mobile clinics, tent clinics, and so on to extend those basic services. Perhaps, in response to your question about the diversion of aid, Adelheid and Mike have talked about our long-term presence in Northwest Syria and indeed across the whole of Syria. We bring in around 30% of the medicines and supplies into Northwest Syria, have done for a long period of time. We use third-party monitoring to determine how well those distributions occur, and we're very confident that prior to the earthquake, those distributions have met all standards. In terms of what's happened since the earthquake, of course, there's always a degree of chaos as you distribute aid following a major acute emergency like this. But yesterday, I can tell you stories. I mean, I saw a man who'd been discharged from hospital following treatment of his fracture. He had what are called external fixateurs, metal, scaffolding, if you like, holding his bone together. And patients like him need antibiotics. He was sitting in his collective center. I said, did the doctors give you antibiotics? He said, yes. And he pulled them out of his pocket. So from the visits that we took yesterday, going to hospitals and clinics, asking if they have enough medicines, they agreed that they did. The doctor said they had sufficient medicines. What they're lacking is the equipment that we need, the heavier equipment to get these hospitals fully functional. So I'm sorry that I've taken up a bit of time there, but I hope I've been able to convey the needs and the fact that the distributions are going well, but we've got a lot more work to do.
Thank you so much, Rick, for a really comprehensive answer. That's great. And I guess with this, we're anyway at the answer of our briefing today. Yeah, let me remind everyone for the bureaucracy, you'll see you'll get the recordings right after this briefing, and the The full transcript will be available tomorrow during the day. Any follow-up questions, please, to media inquiries, and back to Dr. Tedros for closing.
Yeah, thank you, Christian. Many questions about Syria, so would like to probably add some points to that. As has been said, the Syrians actually believe that the earthquake is a lesser evil. It's another evil, but a lesser evil compared to the 12 years of conflict. But not only that, the displacement, the economic meltdown, of course, COVID on top of that, then earthquake. Anybody can see through what kind of hell the Syrian people are passing. And maybe to share my surprise, I was in Munich and attended the Munich Security Conference last week and over the weekend. And many leaders have spoken, but I haven't heard any mentioning the crisis in Syria. And as Mike said, I'm glad that the media is interested and bringing focus into Syria, because it really deserves the attention of the international community. But in international security meetings like Munich, for leaders not to mention about Syria means can tell you a lot. Then I hope the warring parties will use this as opportunity, because whatever humanitarian support WHO provides or other humanitarian agencies provide will not address the problem. We may save lives, but the most important thing now is the political solution. And that's why warring parties now should use this earthquake as opportunity to talk to each other and bring political solution. Of course, side by side, we need to do the humanitarian work, but I think a political solution is the way forward, and we hope peace will come to this country. During our recent visit, town after town, the level of destruction is unbelievable. I don't think there is any country that has been destroyed to this level. So I hope the Syrian leaders will take this as opportunity to bring political solution to this long-standing conflict that has already destroyed Syria. So from WHO side, again, we will do our best, and we have teams on the ground. We will continue to do that, and we will continue to advocate for access, whether it's cross-border or cross-line. Every Syrian should be reached and served and supported during these difficult times. And we call on all parties, not only finding a political solution, but not to politicize also the humanitarian support, and be ready to give full access, whether it's through cross-line or cross-border or other mechanisms to save lives in Syria. So thank you again for joining us, to the press, and for raising, I think many of the questions were focused on Syria, raising this issue, and see you next time.
Recording stopped.